Confusion is mounting in the U.S. over the use of face masks. The Delta variant is now spreading in every state. It's also making its way around the globe, prompting the World Health Organization to encourage face coverings even after vaccination. But the CDC says it has no immediate plans to change its mask guidance, leaving that decision up to the states. David Begnaud has the latest.
Tonight, a new warning in the state of Illinois. Don't let your guard down and mask up, even if you're fully vaccinated.
If you're going into a heavily crowded area, you don't know if somebody is not vaccinated. And so you should just bring your mask with you and keep safe.
That statement from the governor follows health officials in Los Angeles who say everyone inside public spaces should go back to wearing masks. The worry? That highly transmissible Delta variant, which is now responsible for 26% of cases in the United States. And that makes vaccinations all the more urgent. It's the southern states that are lagging. Take Arkansas. Less than 35% of the total population is fully vaccinated. At Trio's restaurant in Little Rock,
we had a sign that said masks optional. We replaced that with masks strongly encouraged, except when you're eating, and we're requiring all of our staff to wear masks. It's the smart thing to do. I think it works.
The governor says the bigger cities aren't having the problems that the rural areas are.
The availability is not a problem. It is simply getting people to take time off their work or off their daily activities and say this is urgent.
It just felt like there was something sitting on my chest.
We met 25-year-old Ashton Reed from southern Arkansas at this hospital here in Little Rock where she nearly died from COVID-19. Just 30 weeks pregnant, doctors had to do an emergency C-section. She and her husband, Chase, are now on a mission to educate others. Do you feel a sense of guilt?
I do feel a sense of guilt because, instead of not taking it seriously, I should have been promoting of getting the vaccination because my wife was pregnant.
Their baby is expected to spend about 2.5 months in the hospital because she was born premature, because her mother had COVID. I asked the hospital, what's a ballpark figure? Give me a ballpark for the type of medical care someone like Ashton and the baby would receive. You know what they told us? Before insurance, the cost could be close to $3 million. A COVID shot is free. Lana.
Oh my goodness, David, thank you. For more now, I want to turn to Dr. Kathleen Neuzil. She is a professor in vaccinology and the director of the Center for Vaccine Development and Global Health at the University of Maryland School of Medicine. Welcome, doctor. Thank you so much for being here. So I want to ask you about what Dr. Anthony Fauci told CBSN earlier. He said that there are two things that concern him about the Delta variant. One, it spreads more efficiently from person to person, and second, it can cause more severe disease. How destructive do you expect this variant to be here in the U.S.?
Yeah, I think Dr. Fauci is right to highlight that overall in this country, we're doing very well. But we have underestimated this virus before, and now we are seeing a new variant. It is transmissible. It's more transmissible, and it's growing in terms of the percent of COVID we're seeing in the U.S. The CDC just announced today that it's about 21% of all viruses in the U.S. So the good news is the vaccines work against this strain. But all risk benefit is local. And as we just heard, there are areas of the country with low vaccination rates and increasing Delta virus.
So let's continue to talk about that a little bit more, because Dr. Fauci also warned that the Delta variant could divide the country in two, where one side is well vaccinated, but then the other experiences the full force of the Delta variant because the vaccination rates in those areas are so low. Why is that particularly concerning to you?
Well, I think it's concerning because we've made such strides in the last few months with the rollout of vaccination. We're seeing historic lows. Again, if you look at the country as a whole, we're seeing historic lows. Not since March 2020 have we seen such low case numbers and such low deaths. So we really have to keep our guard high so that we don't slip back. And this is similar to other vaccine preventable diseases. We have very high measles vaccination rates, for example, in this country. But the people who don't get vaccinated don't tend to be evenly distributed. They tend to occur in pockets. And so you can have high-risk areas where there are relatively large numbers of people who are unvaccinated. And that's exactly what we're seeing right now with COVID.
Let's discuss vaccinations worldwide. Dr. Fauci says that the entire planet is, quote, under-vaccinated, with only 10% of the world protected against the virus. What are the biggest threats right now?
Yeah, you know, the biggest threats are not only to those people in those areas that aren't protected and the morbidity and mortality that they will suffer and continue to suffer. You know, we're at almost 4 million deaths around the world, but also the fact that it is in unvaccinated populations with high rates of virus transmission that we see new variants. So it's the right thing to do to get vaccine to all countries of the world, but it's also the smart thing to do. This is a highly transmissible virus, and we're not going to get out of this pandemic until every country in the world is able to control this virus. It's somewhat concerning that in the last week or two, we have seen an increase in Africa, and that's a continent that is not going to be able to handle a surge in healthcare needs and healthcare capacity. We could be looking at a very grim situation.
Dr. Kathleen Neuzil, thank you.